And we're back on Ask Dr. Rain. Make sure to subscribe to the channel. Make sure to follow us on social media, Instagram at Dr. Rain. And I'm here with Dr. JP Ogalo, the Afrocentric plastic surgeon. Remember I said we're doing the rapid fire questions. People have been asking about it on social media. So, Dr. JP, I'm going straight into the questions. You ready? All right. So the first question is, lipo ni how much?
A fan favorite. I always answer this question by saying, look, it depends. Not everybody needs lipo. But if you do need lipo, it'll roughly anywhere between 300 to 900,000, depending on where you get it done, how much needed to be done. There are a lot of factors in that question.
Let me also ask a question.
Yeah.
Does insurance cover it?
No. But consult your plastic surgeon.
we can arrange.
Yeah, there are always ways, you can make arrangements.
It.
If you really want something to get done, we can get it done for
you. Kenya after all.
Yeah.
Okay, the next question. Can you do my boobs?
Yours.
No, look at this guy. Yeah, so someone else, can you do my boobs? This dude.
Yeah, we do boobs, we do augmentations, we do breast reductions, very common breast reductions. Yeah. Breast lifts, we also do those breast lifts. Fat injections. Yeah, breast reconstruction, also very important for patients who had cancer and that kind of stuff. Yeah.
Okay. So next question. Have you watched Botched? And I'm worried about botched surgeries.
I do not watch Botched. You need to be careful with Botched, all right? The people who show up on Botched are people who went to the wrong surgeons, all right? So if you're going to see a plastic surgeon, make sure you're seeing a board-certified plastic surgeon. You'll notice in Botched, whenever the cases come through the door, they're actually looking or coming to see somebody who has the qualifications in plastic surgery. So that's one of the things you need to make sure that whichever surgeon you're going to see, they say a plastic surgeon, just make sure they're board-certified, and you're not going to see the kind of things you see in Botched. I mean, we do not inject anybody's ass with cement.
And the other thing I saw, you hear that, no cement injections, please. And then the thing is about botched, what I've been hearing from other plastic surgeons and people around your circle is that you're actually getting a lot of botched cases from plastic surgeries that are done outside of Kenya. So it's not necessarily from here. So we're also getting cases where you have to repair botched cases.
Yeah, that's true. We have handled some cases that patients developed, I wouldn't say so much botched, but complications that came in for patients who had surgery done in other parts of the world. The problem with doing surgery in other parts of the world and then coming back to Kenya immediately is that there's no continuity of care, which is very important for us. You need to be able to see a complication very early so that you can address it, so that it doesn't become as bad as you want it. It doesn't become as bad as it is when you come.
Okay.
Yeah.
Okay, this is a more sentimental question for me, especially since I'm, pediatrician with biceps. I'm a first-time mom, 2 years now, and I delivered via cesarean section.
Yeah.
My tummy is now stretched out,
Yeah.
kind of hangs kidogo, and it's a bit numb. Like when I pinch it, I don't feel pain after a while. I'm so uncomfortable with it, and it lowers my self-esteem. Which type of corrective surgery would you suggest?
Okay, there's many ways you can look at it. I'll give one answer. There's this beautiful thing we call the mommy makeover, all right?
Okay.
Specifically designed for moms who've had, several pregnancies. So usually there are two main areas that you want to address: is the breast and the lower abdomen, all right? So for the breast, we can do a breast lift or a breast augmentation, just to get, the breast and the nipples specifically, where they used to be before you were breastfeeding. For the tummy, we can either do liposuction or we do a tummy tuck, or a combination of the two, depending on what the specific problem is. All right. She sounds like a good candidate for a tummy tuck with some lipo. She hasn't mentioned the breast, but again, we tailor our surgeries or our operations to specific patients.
And one thing that intrigued me about this question, and is also so important about plastic surgery and reconstructive surgery, is that it's so many people have low self-esteem because of their bodies, and not everybody can really self-love themselves or be so confident, after delivery, whether it's, just having problems, like you're going to the gym, you're trying, you're dieting, you're trying to do everything, you're not losing the type of weight or dealing with these post, delivery kind of complications.
Yeah.
What what is plastic surgery doing for what does it do in terms of somebody's morale, somebody's self-esteem, somebody's confidence?
Yeah. Oof, that's a heavy question, because plastic surgery goes a lot more beyond just the knife. Personally, I always take time to try and understand the patient and why they want exactly what it is they want, because sometimes surgery may not be the solution for them. We're also handicapped because our perceptions of beauty and what is beauty, especially in Africa, have been very heavily influenced by things that we see and that happen in other parts of the world. So it's a delicate balance between trying to understand what it is that the patient wants and trying to convince them to get what they actually need. All right, but that also involves a lot of conversation and them introspecting a bit more, and then you getting them to see what beauty is supposed to be. Okay, yeah. So I'll leave it at that.
Okay.
Yeah.
And when people come for such surgeries, you first try to tell them, if you haven't tried working out, and you tell them about the other options. Is there a counseling session before they have any major transformation to their bodies?
Yeah. So yeah, I always say this to my patients. We always see the best kind of results with patients who are very well motivated. Plastic surgery is not a quick fix, and if you expect it to be that, then you're going to end up being disappointed with the results. All right, we get the best results in patients who are keen to work out, and patients who are willing to live a lifestyle that is healthier in terms of what they eat and how they go about their daily lives. And I'm talking about things like quitting smoking, for example. In plastic surgery, that significantly changes the kind of results that we get.
Okay.
Yeah. So stop smoking, exercise, eat well, eat the right things, and we tend to get very good results. But
Perfect.
Yeah, we do tend to have very long sessions with the patients just to get them to understand that. Yeah.
All right. So more quick fire questions. This one says, do abdominal surgical scars have an easy fix, like a cream or an ointment, or is plastic surgery the only option?
There is no easy fix to anything.
Yeah, I think that's the point.
Unfortunately. We get a lot of requests for scar therapy. Scar therapy is a very important bit of plastic surgery, especially this side of the world. A lot of people don't know this, but our skin doesn't heal like the Caucasians heal or the Asians heal. In our sense, it's a bit more tricky. We tend to scar a lot worse than the other races would. So it's important to understand that. Now, scar therapy is always a long-term thing. All right, and you can essentially just divide it into two things. You can say you have your surgical options and your non-surgical options. So your non-surgical options are those things: the creams, the lasers, the injections. And your surgical options include things like what we call a scar revision, where if you have a bad scar, we take it out and give you a better one. Okay. Or we do this thing that's currently one of the really good and gold standards for treatment of scars, is what we call fat grafting. So we take fat from some other part of your body, inject it into the scar. The fat has stem cells, and that allows the scar to heal very nicely. So the approach is usually a balance between the two. So we do, to some extent, use the creams plus the surgery, and it's a combined approach.
Okay.
Yeah.
All right. So the next rapid fire question is: plastic surgery is a sin? So I think they're referring to the cosmetic and the aesthetic side of plastic surgery.
Yeah.
So there are a lot of people who believe that it's a sin, to change your body and things. What's your take on that?
That goes back to our cultural inclinations, or the way we think about plastic surgery. Like, where do we draw the line? I'm essentially changing my appearance by putting on makeup, by putting on lip balm. I'm changing away from kind of like my natural state. So where do you then draw the line?
It's never I woke up like this.
Yeah.
Like even a suit, even the suits play the aesthetics.
Even clothes, even simple things like perfume. Why don't I walk around with just mask?
Ew.
Yeah. The other thing that's an important answer to that question is sometimes we don't kind of really understand and appreciate the kind of how do I say, psychological torment some of these patients go through because of one small blemish in their appearance. You see, to us externally, it's a small thing, but to them, some of these problems are literally almost crippling. All right, they prevent you from having simple things like a normal relationship. We've had patients who are well into their 40s have not been able to date for close to 20 years, just because of one problem that they felt when they go to a plastic surgeon, it could be sorted out, and they do come, right? And afterwards, they're very happy, and they're able to live a normal life. So some of the things we take for granted, we need to be very careful how we handle patients or how we deal with the stigma around plastic surgery, especially in Africa. And again, it's our job to kind of change
any beef
the narrative
from the Christian society or religious societies.
No,
really.
No, we haven't had.
Okay,
much
I think
religious
we're more
pushback from it.
progressive now in times, but there are those few people who still are very conservative.
Again, a lot of the people also tend to do, the operations kind of like in silence, so they won't, shout it out.
Exactly.
Sometimes you wouldn't even know somebody has had plastic surgery done.
That's another thing I've realized about your patients are very there's that patient confidentiality that they require 100%, because I had a really tough time trying to get like people to actually send the questions on video because nobody wants to know once they've gotten their work done, and somebody actually on the socials had to tell me like, look, this is my own personal thing, and because there's usually a lot of judgment and stigma around plastic surgery, some people just prefer to keep it to themselves, and which is they're right.
That's true.
So the last question is, I have been dealing with very large breasts for most of my life, and it's really affecting my daily activities. Can I get breast reduction done in Kenya, or do I need to go to India?
Simple answer, yes, you can get breast reduction done in Kenya. It actually is one of our most common procedures. It's a problem that we tend to have more this side of the world as opposed to the West. Well, now when I'm talking about Afrocentric surgery, you understand what I'm saying. We see it a lot on this side, and it can be very debilitating. The patients with very large breasts, one is that they're ridiculed for a very, very long time. I'm talking about some women are ridiculed throughout primary school, throughout high school, university, until they actually realize they can get something done about it. On top of that, they get a lot of neck pain, back pain. They get some skin changes underneath their breasts that can be very uncomfortable, and it can be generally a very uncomfortable experience having very large breasts. But the work is very satisfying afterwards. It tends to be one of the procedures that we have the highest satisfaction rates for.
All right, and there we have it, folks. Rapid fire questions and answers to the plastic surgeon, Dr. JP Ogallo, aka the Afrocentric plastic surgeon. And if you want to reach Dr. JP Ogallo, you can check out his contacts. They'll be on the description, and also the ones that you see on the screen. So make sure to follow him. If you have any questions, he'll be glad to help out. If you need anything done, he'll also be more than glad to help out. Kaching, if you know what I mean. So remember, ask Dr. Ray, follow us on the socials, subscribe. This has been another episode. Peace out.